Melania Trump has gone from her role as a beautiful model to First Lady. I'm going to explore with you whether she has undergone any cosmetic procedures to enable her to maintain her beautiful appearance. Here we see a photograph of Melania at the age of 17 in her home country of Slovenia when she was a young model. And what we see here is a well-proportioned face where the dimensions of her face are equally proportioned in terms of one-third, 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 and of course horizontally across her face she also has good equal dimensions. And you can see two distinct features that she has that I want you to pay attention to because you're going to see that they evolve differently over time. The first dimension is around her eyes. Her eyes are oval-shaped, almond-shaped, and have a bit of a flare at the end. So what is an almond-shaped eye? It's like the shape of an almond nut, which means it's oval, but it also has a greater length than a vertical height. That's the first feature you should take note of. The second one, of course, is her nose. And you can see in this photograph that there's a little broadening of the dorsum of her nose, which is the bridge of her nose, is a little broader, and there's a little fullness of the tip of the nose. And what we see from the lateral picture of her is there is a little bit of this dorsal hump or dorsal bridge. The bridge of her nose has a little slight hump there. So we're going to take note of that as we evolve and look at some of her photographs in her later life. 12 years later, at the age of 29, we can see Melania looks quite different. Of course, it's 12 years later, but you can, if we focus on a few areas, we can see there is a suspicion in my mind that she's undergone some surgery. Specifically, it looks like she had a rhinoplasty because the width of her nose has now narrowed, particularly above. So what happens is when you do a rhinoplasty, commonly there's a kind of a narrowing procedure to collapse this triangle and make it a more narrow dimension of the nose. She might have also had some work on the tip of her nose. It doesn't look quite as bulbous as it did when she was younger. And then if we work down from there, we can see she has good tooth show of her upper palate when she smiles, but her lips look like there's a one-to-one dimension, which is different from what she had originally as a child, or as a young woman, I should say, when she had a 1 to 1.6 dimension of her lips. So 1 year later, we see her in the year 2000, and there is a subtle change that has occurred that I think is present, that wasn't present in the prior photograph, and that is she has a fullness in this region here. It looks like she had some kind of augmentation of some kind, either a hyaluronic acid gel filler or fat grafting. I'm not sure, but it looks like there's some filler that was placed in here to create this round, smooth contour in her mid-face area. So here we see her in 2002, and what we're looking at is someone who has, again, fullness of the mid-face area, very strong bones, malar bones we call them, but there is some kind of hollowing that's occurred over what's called the buccal recess, which is over here. These are buccal fat pads. I don't know if she had any alteration in reduction of those fat pads, or it's just the way she's moving her expression on her face that's outlined in these areas, but there's some hollowing that apparently is there. So 1 year later in 2003, we now see kind of a fullness that extends from her lower eyelid all the way down to her jawline. And her jawline is well defined. She has this fullness in the buccal region. I don't see that kind of hollowed out area there. I don't know if she was previously on a diet. I don't know if she had some other alteration of her fat pads. But here we don't see that same hollowing effect. Her almond-shaped eyes are, again, very distinctive. It's narrowing her aperture of her eyes, but it's a very distinct feature. And we're going to discuss exactly my theory about those eyes in a moment. So here we see her 1 year later, and we can see that there's this lateral hollowing of her face, and that recurrent hollowing implies that the fillers or whatever she did to enhance the volume of her face seems to be wearing off and changing back to the way it was 2 years prior. So in 2005, it appears the contour of her face has changed somewhat. It looks rounder, fuller. I don't know if she's having more filler put in to balance out her face. It looks all very natural, of course, but compared this picture to the prior picture where her face was more V-shaped, a little more hollow, temporally. Is it a diet? Is it filler? I don't know exactly what happened. But another thing to take note of is as she smiles, she has no crow's feet over here. She has no frown lines between her eyebrows. So it appears that she probably had some Botox, and she had fillers in her lips, of course, which is very obvious. This is another shot from 2005. I don't know if it's before or after the prior one, but what we can see is that her muscles around her lower lids are very distinct, and she has crow's feet in the corners of her eyes, which indicate that she had some Botox that was wearing off, so to speak, compared to her other picture where she's smiling and has virtually no lines at all. In 2008, we're seeing a kind of a scant side view of Melania, and what we're looking at is a very distinctive jawline. It's a beautiful contour from the tip of her chin to the back of her jaw, and her neck is very tight. There's no laxity of her neck. There's fullness of her cheeks, and the dorsum of her nose is very straight. It's been straightened out with a presumed rhinoplasty from her younger days. But what we're looking at also, and I want you to focus on, is the eyelid and the lateral contour of her eyelid, because it appears that she has this very high sweep to her lower lid, and it's almost encroaching on her the aperture of her eye, and this is usually associated with Asian eyelids. And it is well known that in the year 1248, Genghis Khan had invaded Slovenia and left behind some of his genes in the process of conquering that land. And it's very possible that there's some telltale genes that Melania has related to the Mongols attacking Slovenia. And in fact, this is called a Mongolian slant and is associated with Asian eyelids. So we can see in 2009 that Melania is retaining her appearance, again, flawless skin, almost no wrinkles, a fullness of her face, and apparently she's using some fillers to fill in some areas that are hollow and deep. And again, in 2011, she looks a little thinner in this photograph. It may just be because of her hairstyle, but she looks kind of a little bit less full in the temporal regions of her face. In 2012, we can see her neck is tight, with virtually no weakness of her platysmal muscles at all, and she has a few crow's feet. Other than that, she looks unchanged. She's now 48 years old in 2018, and we can see this fullness of her face, which of course can be related to either injectables or just maybe the normal aging process. She's starting to show, however, some weakness of the muscles on her neck, and you can see those platysmal bands starting to emerge. Her eyes themselves starting to look a little crowded up here, because as the brows start to descend, her eyes are become a little recessed relative to her projection of her face. We can see her eyes are kind of becoming recessed, and she has a few crow's feet in the corners of her eyes, but it looks like she doesn't have a wrinkle on her forehead. Again, probably Botox related. And 6 years later brings us to 2024, and here we see particularly a weakening of the neck muscles, and we can start to see those bands starting to emerge right below her central neck. And she still has pretty good contour and demarcation along her jawline. She has a few crow's feet. Again, not a line on her forehead. Her face itself looks like there's been some fillers put in around her nasolabial folds. There's a little bit of this fullness around her mouth, with a little projection of some of the fat and laxity around her mouth, which is, of course, normal for her age. And we are starting to see some age-related changes that are starting to occur, which, of course, is normal for someone who's 54. Melania Trump has aged very well over the many decades that we see her evolution from teenage years up to the present. Now, she's done that with relatively minor interventions. She started out as a beautiful young woman, and she continues to be beautiful even into her 50s. And we're going to continue to see her in the spotlight over many decades, I'm sure. Of course, it's speculation, what I've said. It's not fact. I don't know all the details of what she's done or what she hasn't done. But it looks, in my professional opinion, that she's had some minor interventions over time. If you have any questions regarding her, please leave them below. I'm more than happy to answer them. And I look forward to seeing you in my next video.